Hello everyone.
Good evening, good evening. Seems like today we are getting to class slowly. Let's give ourselves like the next 3 minutes, then the class starts. I hope we'll have a sizable group. By this hour huwa tumefika 40. Today sielewi, mambo ni mengi. So let's give ourselves like 3 more minutes, then we start the class. Lakini karibuni.
Sandy.
Thank you, daktari.
Vile tu watu wanaomboleza baba.
Colleagues, let us start the class. Someone made a message, made a sound that said that people could still be mourning. It is a whole country's mourning, and so we understand. As we move on, they will join us. And before I say much, please let us have a prayer. Just unmute and pray for us. Joshua Moya.
Let's pray. Our Father and God, we thank you for this time. Thank you for the class which is ahead of us. We pray for everyone, Lord, that Lord, you may give us understanding of cooperation as we see the end of it. Honor and glory shall be to thee. In Jesus' name we pray, believe. Amen.
Amen. Amen. Thank you so much, Joshua, for the prayer. Once again, thank you so much for those people who are still working on their projects, those who are reaching out to me to check whether the question is okay. Don't shy away. Whatever you have is what is yours. It doesn't have to be perfect. Remember, we said we got to start from somewhere. So what you have, just send it to me. We will work with it as it is. We will get a way forward. Remember, it is an issue that speaks to you. Let what speaks to you come out. So whatever topic is in your head, share it with me. We see whether we can craft something out of it, and you start on your research. Remember, we said it's something that's going to bring a difference in our lives, the lives of the learners in our schools. So don't shy away. Kila mtu ana kile kinachomsumbua na angetaka kukitatua. So just feel free to send that work to me. There are a few issues that were happening last week with the LMS, but now it is okay. We are able to start. I will be checking on the LMS to see how far we are, and especially now that we have said we embark on the practicum, we've said people to start testing the waters, and Salome talked a lot about it. We also agreed that if you feel there's another area in the practicum that you would want me to bring Salome back, we said we do not shy away from our experts. I will still bring her on board again so that she can put everything straight for us. Remember, we are in the process of being. Hatujafika. A day at a time. The little I do on a daily basis, the more I keep on being positive about myself and about what is happening around me, I am able to move on. Remember, what is happening around us is not what affects us. It is what we internalize. We give it a name. By the time we are giving it a name, we're already telling ourselves we are not able to move. And those are the things that bring us down, the things that make us not be able to move on. Once again, we are getting Dr. Margaret, and tumemzoea sana. And she keeps on telling us she's a teacher, and it is true, I'm telling you. She is so passionate about being a teacher and about taking us through all the work that you're doing. Florence, I'll give you a chance so that I hear what you have, then I bring in Dr. Margaret. Florence,
good evening, Daktari.
Good evening, Florence.
You brought up this issue of LMS.
Yes.
I just want to request, there has been a bit of hitches. I've reached out inbox to Aquila and he has helped with it.
Amen.
But I'm still noticing, like if you look at topic 4 and 5 are the same. I've not reached that far, but you can see the topics are the same.
Okay.
Topic 6 and 7 are the same.
Okay.
So we are requesting, because there are those of us who will be engaged in the upcoming exams, and we'll have very limited time once the exams start running. But these 2 weeks, we have a lot of time that we can work on LMS. So kindly help us have those hitches corrected. Thank you.
Thank you, Florence, that you've been there and you've been able to notice that. Elvis, you're on the line, so I know umesikia. Please check those units and see what's happening. I will do the same. Thank you, Florence, for bringing it to my attention. I'm not sure hiyo ningekuwa nimeona even if I was going through. Asante sana. And now, Dr. Mwaura, you require no introduction. Please come in. Karibu sana.
Thank you. Good evening to my colleagues, the teachers. I'm here once again, joining you in this journey, and I've always enjoyed being with you. And this is another opportunity that you have been granted to interact. You can imagine how happy I am to have all of you around. Thank you, Dr. Grace, for this opportunity once again. And this is my folder. Teaching is my folder. So thank you for granting it this particular time. Okay, teachers, Dr. Grace has mentioned something that will be our theme tonight as we learn about this other theory of counseling. And Dr. has said, what is happening around us does not affect us. It is our internalization of what is happening around us. And that will be our theme this evening. That what is happening around you, around me, even what has happened to our nation, around us, is not what is going to affect us. I'm happy that somebody said the nation is still mourning. It is true. It is true. But how we internalize it is one that you make us develop what you call resilience. That is, we must bounce back. We must stand again. We must give ourselves strength and move on. But if we internalize it, you'll become hopeless and helpless and you'll be grounded. And the situation will not change. But it is so painful to me and to all of us. What has happened to us? It is affecting all of us. But with this evening class, we are going to learn how to interpret what is happening and what has happened and what has been happening to us as individuals so that we can heal ourselves and we can also heal others. Remember, you are an wounded healer. A counselor is an wounded healer. You have to heal others. Even as we continue internalizing the hurtful happening in our country, you need to heal others so that the whole nation can start again, so that the whole nation can start moving on. Because it's very costly to not to rise up again and to continue with what we need to do. Okay, so thank you so much. So tonight we will be guided by that theme that what happens around us does not affect us. It is the interpretation we give to it. That is the theme tonight. And as we engage with today's evening, we will be discussing another theory of counseling called LEP, that is motive therapy. Rational emotive behavioral therapy. We call this REBT in short form. And as we realize that you have covered so many other theories, and a theory is an approach. Each and every theory has got a specific approach. And that is why as a counselor, you need to know what kind of an approach is appropriate for your clients. So you need to be very analytical. You need to be thoughtful. You have to be very critical to know which theory are you going to use. Are you going to breed? You can breed 2 or more theories. But it's very, very depending on the perspective or depending on the issues, the counseling issues of your client. We have discussed the behavioral theory that target the behavior, changing of the behavior. You have covered psychoanalytic theory. It touches on childhood experiences, the conscious and unconscious. You have dealt with the reality therapy. You have dealt with the person-centered therapy, where you create a very conducive environment for the client to thrive. And now we come to the rational emotive therapy. So in this therapy, we are now targeting the thoughts, we are targeting the feelings, we are targeting the behavior. So if you think your client need intervention in terms of the way they are thinking, in terms of the way they are feeling, because sometimes we are sick because of our feelings or emotions, or in terms of behavior, we can be sick because of our behavior, then this is the best theory to use because it targets the 3 faculties of a human person. That is the thoughts, the emotions, and the behavior. So without much ado, let me share my screen. Is my screen visible? Yes. Okay, thank you, Emily. So it is rational emotive behavioral therapy, a very, very important kind of therapy. That is actually what I normally use for myself and for my clients, because I realize that I can touch a lot of what my clients are suffering from. If they are suffering from thoughts, I am able to touch on it. And if they are suffering from feelings, if they are suffering from behavior, I'm able to touch on it. So it gives me a more holistic view of attending to my client, even myself.
Daktari.
Yes,
daktari.
Yes,
fugua presentation tunaiona lakini hujaifungua. Haijafunguka, yes.
Let me stop sharing, then I do it again.
Okay, please.
Am I sharing now?
Yes, imefunguka.
Okay, thank you.
Okay.
Okay, that is rational emotive behavior therapy. I've said it covers most of the areas where the counseling issues emanate. And so I find myself using this most of the time. And I'm a great friend of rep, even on myself, because sometimes I find that they are my thoughts that has got issues. What am I feeling? What are my behavior? Okay, so LEP, as we have just said it, it's mostly about what you think. It is about our thoughts and how our thoughts affect how we feel and how our feelings affect our behavior. There is interrelationship between the three. Even what I do affect how I feel. For example, if I'm a teacher, if I miss a I feel guilty because I've missed a class. So my behavior of missing the class will affect how I feel. And my feeling also will affect what I think about myself. I may tell myself, I'm not a responsible teacher. I wish I knew I could have done it better. So the behavior can affect our feelings and can also affect our thoughts. And likewise, our thoughts can affect how we feel and can also affect our behavior. So this kind of therapy was advanced by a great man called Albert Ellis. Albert Ellis, a very visionary psychologist, and a very great contribution in modern psychology, because as we have said, most people will tell you that I am a LEP counselor. I am a LEP counselor. I use LEP counseling. And so we honor him. We honor him with this rational emotive therapy. And he came up with this therapy 1950. And it was initially a simple therapy. But after borrowing so much from other psychotherapists, he was able to put the behavioral, about the behavioral and also the cognitive and also the emotional therapies together. And he came up with a holistic view of a human person. So he was a very learned man, who did his MA and PhD from the University of Columbia. And after that, he engaged in empowering therapies. And he is one of the most influential psychotherapists in his time. Therefore, what is this REP we are talking about? We have said that it is an idea whereby we consider what are our thoughts. What are my feelings and what are my behavior and what am I communicating about my thoughts? Because there is the power of the tongue. If you communicate negative thoughts, then that is what you become. If you confess negative feelings, that is what you actually become. And this idea of telling yourself, I must do 1, 2, 3. So we put a burden on ourselves. And if we don't achieve what we think we must, then that become a canceling need altogether. And so he was saying that in our everyday life, let's talk about I should. Let's not be so much demanding on ourselves, because I'm meant to ourselves, we demand our thoughts. We feel bad because we have not achieved what we wanted to achieve. And then our behaviors are also affected. We become hopeless and helpless. We lose the energy to move on. And so Aries initially practiced psychoanalysis. You know, psychoanalysis by Sigmund Freud. We have done it. Sigmund Freud was talking about our childhood experiences and how they affect our adulthood. He was talking about our hurtful, our traumas, our beliefs that are hidden in the unconscious. And sometimes they can find their way in the conscious and affect how we feel. He was talking about the personality, the 3 elements of personality, the evil, the super evil, and the id, and how they affect us, and so on and so forth. So Aries was a psychoanalyst. But he realized that psychoanalyst, there was something that was not very clear about psychoanalyst. It was not clear about our thoughts. Sigmund Freud was talking about our conscious and unconscious and subconscious, but he was not talking about our thoughts. He was not talking about the feelings. And so he formulated his ideas and put them together in what we are calling REP. At first, he was calling it rational therapy. Very simple. He called it rational therapy. But later he thought that he can accommodate more aspects of a human person, the feelings and the behavior. And therefore, he now changed the name to rational emotive behavioral therapy, whereby he could be able to focus on our thoughts, he could focus on our feelings, and he could focus on our behavior at the same time. So what does REP mean? 1, rational emotive. This is part of the name that emphasizes the goal of replacing irrational beliefs with irrational ones. That is, the moment we have irrational beliefs or thoughts, then you are completely sick. But there is the opportunity of replacing those irrational beliefs with irrational ones and healing ourselves and healing our clients. Each one of us has been irrational at one time or the other. And that is very human to be irrational. But it's not human to remain irrational. So according to Ellis, we can help ourselves change irrationality, and we can help our client to change their irrationality. We can help our students to change their irrationality so that they can live a very fulfilling lives. Then there is behavior. This part highlights the focus on how thoughts and emotions influence actions. with the aim of changing both to achieve healthier behaviors. That is, the thoughts and emotions, they dictate our behavior, they inform our behavior. So if the thoughts are negative, then they create negative feelings. Then our behavior will be a product of negative behaviors. And then we have the therapy. This indicates is counseling or treatment to help individual. A therapy is a form of counseling, is a form of treatment or intervention to help people who have got emotional, psychological, behavioral, even social needs. And that is what we are called to do as teachers. So what are the core assumptions of this therapy called rational emotive behavioral therapy? One of the assumptions is that you and me, we are rational and we are irrational. We have a tendency to be rational and to be irrational. We have the capacity to think positively and negatively. And this is inherent in us. Inherent means we are born with the capacity. We are born with the capacity to think rationally and irrationally. So you need to know that at one time you will find yourself irrational, and it is normal. And this irrationality comes with self-defeating beliefs, beliefs that actually ruins us, beliefs that it drains us our energy, beliefs that it drains thoughts, and so on and so forth. So that's why we are told in counseling, don't judge. Don't judge. Some people may be rational sometimes, other times irrational. So don't judge anyone, because you also have the tendency to be rational and irrational. And that is why, according to Rept, the work of the counselor is to help us to change irrationality to become more rational. 2, beliefs, not events, cause emotional distress. That is what we believe. And I want to echo what Dr. Grace said, that what is happening around us does not affect us. It is the internalization. And then I said our theme will be what is happening around us does not affect us. It is the interpretation we give to it. Therefore, beliefs are very important because they causes us emotional and behavioral distress or otherwise. The events that happens, whatever happens, if we give it the right interpretation, the right interpretation means we give it interpretation that is going to sustain us feeling self. That is interpretation that dictates our self-compassion, because we don't want to be hurt by what has happened. So we give it an interpretation that is not going to distress you. It is going to create tolerance. It is going to maintain your calmness and so on. Therefore, what happens, and you are going to look at this later on, what happens does not cause any harm to us. They are the beliefs. Number 3, irrational beliefs are learned and can be unlearned. We have said we have a tendency to be rational and irrational. And therefore, we can actually dwell on the irrational if we want to. We can learn to become irrational. We can learn to interpret things negatively, always defeatist manner. And we can also learn to be rational. Therefore, the individuals need to identify our irrational beliefs, challenge them, and replace them with the more rational ones to reduce psychological disturbance. So our clients, ourselves, will be disturbed psychologically just because we have accommodated irrationality or irrational beliefs, and we have refused to challenge them, and we have refused to replace them with the rational ones. The other assumption is that unconditional self-acceptance is crucial. For a human person, we need to accept ourselves the way we are. We need to give ourselves unconditional positive regard or unconditional acceptance. Even when you think you have made mistakes in life, sometimes you have to normalize mistake as a human. And you ask yourself, what can I learn from that mistake? But you don't blame yourself so hard. Don't beat yourself so hard. Have self-compassion. When you lack self-compassion, then, of course, you will be disturbed. So having self-acceptance is very important. Taking yourself as a normal person, taking yourself as a vulnerable person who can make a mistake is very important for this therapy. Then the other one, the nature of human person according to Reb is that thoughts, emotions, and behaviors are interconnected. There is what we call reciprocal relationship. They influence each other. The thoughts influences the emotions or the feelings. The feelings influences the behavior, and vice versa. And therefore, every time we have an issue, in most of the time when a client comes to you, in most of the time, it is either because their thoughts are not okay, the emotions are not okay, and the behaviors are not okay. So if you help the client to address their irrationality, then that affects how they feel about it. It also affects their behavior. If you help your client to overcome dysfunctional behaviors, then it makes them feel good about themselves. It also affects how they think about themselves. Therefore, emotional problems will always come because of irrational beliefs. Our behavioral problems are rooted in irrational assumptions. Like, I must do this. I must be perfect. I must be loved by others. I must go for that meeting. I must eat this. I must drink this. So if I don't find it, I'm disoriented. So having a flexibility kind of mind that if I cannot go there, I'm okay, and I'm going to forgive myself. It's not my fault. And I will not feel guilty about it. If I cannot do this, it is beyond me. Others are doing it. It is okay. I am unique. I'm not like them. So having a flexible kind of thought to accommodate yourself in any given situation, and even accommodating others. When you meet a client, some clients are sick because there's something they had said, I must do, I must go. I must. And they were unable to meet their must. And so they are sick in mind. They feel bad about themselves. And they start even coping, and they started developing very negative coping mechanisms. So it has affected the way they think, it has affected the way they feel, it has affected their behavior. So we are saying from these assumptions, from those assumptions that we have discussed, the work of the counselor is to know and to bear in mind the connection between the emotions, the cognitions or the thoughts, and the behavior. So when you're talking to a client, you have to see this connection and see which one do you want to target. Do you want to target the thoughts? Is your client suffering because of the thoughts or cognitions? Is your client suffering because of the emotions? Or is your client suffering because of behaviors? Even asking ourselves, when we suffer, what is making us suffer? Is it our cognitions? The irrationality? Is it our emotions? Is it our behavior? And then we address where the problem is. Then two, from these assumptions, counseling is directed towards thinking and acting rather than expressing the feelings. Because if I express my feelings and have not targeted the underlying issues, remember the Sigmund Freud theory about the underlying issues. And he was saying, whatever we see, whatever you see in your client is just a tip of the iceberg, a tip of the iceberg. There is so much underneath. And therefore, for a counselor is to help the client to bring what is underneath into the surface so that the client can be able to process what is underneath. The same way in REP, we need to target the thoughts, because the thoughts, we will not see them in counseling. We can't see them, but they could be affecting your client. They are underlying. Therefore, we need to really know and make effort to know what is your client thinking. And that is how we'll be able to deal with the problem from the root cause. Then from the assumption still, therapy is seen as an educational process where the counselor functions in many ways, like a teacher, teaching clients how their thinking affect their feelings and their behavior. So once you become a counselor and you want to use LAB, remember, you are now a teacher. You become a teacher. Teach the clients how their thinking is affecting their emotions and how their emotions are affecting their behavior and vice versa. And you're going to see how you can become a teacher using rational, emotive, behavioral therapy. Just the way I'm teaching you, you need to teach your client so that they understand. Once they understand, they will say, oh, is that the case? Then they are going to make effort to deal with the real issue. The issue that is bringing those thoughts, the issue that is bringing those emotions and even those behavior. So that was just introductory. So you're saying what we are going to cover. We are going to cover one, areas in nature in them. We are going to look at psychological disturbance. We are going to look at the process of change in REP. We are going to look at the goals of counseling. We are going to look at the therapeutic relationship in REP. We are going to look at the role of the counselor in REP. We are going to look at the ABC. In fact, it will be called ABCDEF model of REP. And we are going to look at the techniques. So now that we have looked nature, we have said that one, we are born with the tendency to think rationally and irrationally. That one I think we have understood. Secondly, all of us have got a tendency towards growth and actualization. All of us can grow. All of us can develop. All of us can reach actualization. I hope you have done the theory by Maslow, Abraham Maslow, about actualization. But most of us, we have not been actualized because we have sabotaged ourselves. We have sabotaged this tendency for actualization by having unrealistic, illogical, and other maladaptive thinking. You can imagine maybe you are stuck where you are because of this sabotage. Simply because your thinking is unrealistic, illogical, maladaptive. You are going to meet clients who are also stuck in life because of the same. And then changing our irrational thinking style is not always easy. It may sound so easy when I'm talking about it, but it's not easy to change our way of thinking. Sometimes we find ourselves overcoming irrationality. Other times we find ourselves being irrational again. And it's like a cycle. So it needs effort. If there's something you want to change, if there's some thought, some belief you need to change, it requires effort, repeatedly reminding yourself about the change and adopting the change itself. And then the other thing is that we have said we have the ability to construct self-enhancing thoughts. We have the ability to have a very powerful thought that enhances. We have the ability to have very strong feelings that build us. We have the ability to exhibit very powerful behaviors. That all this can help us to live a better life. But remember what we have said, we sabotage ourselves. And the sabotage starts with the way we think. Because you have said once again, we think negatively, you affect your emotions, you affect your behavior. So we are saying once again, irrational belief, we are all irrational at one time or the other. But we can become rational. The good thing is we can become rational. But we have said it's not easy. With some effort, we can change our thinking. So counseling, therefore, should help the client to develop a rational philosophy. A rational philosophy is whereby there is greater happiness and less emotional distress. And the work of the counselor is to help the client to identify those beliefs, the negative beliefs, and help the client to replace them with the positive beliefs that can prompt our survival, that can bring satisfaction, that can give us a positive way of dealing with others, and even give us personally fulfilling endeavors. Remember, the client will not come to you knowing that they have negative beliefs. It is you to help them identify. Your student may not know that they have negative beliefs. They are self-sabotaging. It is you, the counselor, to help identify for them. That's why they need your help. Therefore, the counselor encourages the client to be open to testing their assumptions. Some of them will come in great denials, and help them to examine the validity and functionality of their beliefs. Convince them, persuade them to adopt new beliefs to guide their behavior. Therefore, the counselor work is to, we said it is to teach them about how the beliefs, how the thoughts, how the behavior are interrelated. So once you have taken through the client into this adoption of new beliefs, then they become well-adjusted. And to become well-adjusted means they accept themselves unconditionally. I don't know whether there are those, some of us who don't accept themselves unconditionally. Those times I never used to accept myself unconditionally. I thought I could be better than I was. I could judge myself. So accepting yourself the way you are is the first thing. Accepting the client the way they are in a counseling session is already an achievement. It's a step towards the right direction. Then do not judge their worth. A well-adjusted person will not judge themselves according to what you achieve, because you may not achieve all what you have wanted to. You may have limitations to some of the achievement. So you have a non-judgmental perspective to the self. Then the other one is enjoying life is more important to them than proving themselves. They like enjoying life with what they have, with whatever in their own context, without making another person or striving to have another person approve of them. They take risk, but not foolish risk, and pursue healthy adventure. You know what I mean when I talk about foolish risk? For example, when you adopt a negative coping mechanism, you know what it means. We talked about it when you're dealing with behavioral therapy. You can adapt it to drinking, to smoking. Those are risks. Even healthy adventure. I am not going to have an outing where I spend all my salary. No, I'll calculate how much can I afford, which is a joy that my pocket can accommodate. Then also they are realistic and accept that they cannot get everything they want, nor avoid all painful situations. Accepting your situation, accepting your limitations, accept even the pains as part of life. Like all of us are mourning, like somebody said from the beginning, we are all mourning. We cannot avoid painful situations. We will not avoid them. And therefore, we accept the reality of our time. And we continue doing what we can do. If it is coming to class, just go to class, because we cannot avoid these painful situations. It has happened. And we can't look back. We want to move on, because this is the reality of life. Then they do not strive for unattainable goals or unrealistic perfection. That is, they set their goals, and their goals are smart goals. They don't want to achieve perfection because they understand their imperfection. They understand that their problems they cannot solve, any problems they may have to live with. Even as much as you are doing counseling and you'll be helping others, you have to understand that there is what you call coping. Some problems you cannot wish them away. We have to cope. There are problems that can be solved, and there are problems that we have to live with. So we must know what we can change and what we cannot change. That is an adjusted person. They do not blame others. They do not blame fate or the world for their distress, but they take responsibility for their behaviors, thoughts, and feelings. Yes, blaming others is like you don't want to process it yourself. You want to put a burden onto other people. And therefore, you will never develop the problem-solving skills, because you're always blaming others. But you take but the adjusted person will take responsibility of my thoughts. Yeah, I'm the one thinking about it. I'm not blaming anyone. These are my emotions. I will not blame anyone. Because if somebody has provoked me, honestly, I can choose not to be provoked. I can choose to manage my anger, my feelings, my emotions, and also my behavior. I will not blame anyone, because I have a choice of how I want to behave. They are not in the habit of giving up. The people who are adjusted according to REV, they don't give up. They continue pursuing their interests, making themselves happy and other people. They make sacrifices, but only when it is for the good of the people, both and social. Means they are not selfish, they think about other people. Then they act morally. They care about other people's rights and contribute positively to the society. Allow me to move faster. They are independent and assume responsibility for their life, but they are open to cooperate with others. They accept that people, including themselves, can be right or wrong. We are not angels. We are not angels. We can make a mistake. Others cannot also make a mistake. So we allow other people to be vulnerable, just as we are also vulnerable. They do not accept bad behavior, but they also do not condemn people because they are wrong. This is the spirit of the spirit of a counselor. You don't condone bad behavior, but again, you don't condemn other people. You give them an unconditional positive regard. And your main responsibility as a counselor is to help the people identify, know themselves, identify their thoughts, identify their feelings, and identify their behavior, and look for ways of adjusting them. They can reflect rationality. Then they are flexible. We have talked about being flexible. We are not rigid on ourselves and on other people. Don't say this is me, I cannot change. What we are, we have learned. And we can unlearn who we are, and we can become better. Then they accept the fact that nothing is ever certain in the world. Although they prefer some degree of order, they remain open to the uncertainties in life. That is, knowing that anything can happen to us anytime. We have no assurances of tomorrow. And therefore, they remain positive for life. And when something uncertain happens, they're able to adjust. They develop resilience, they bounce back to life. And they pursue healthy interests around which they structure part of their life. So according to Rev, this is the kind of a person you need to bring your client to. This is a position you need to bring your client to. From that position of helplessness, from that position of irrationality, from that position of negative feelings, and the dysfunctional behavior, you bring them to be an adjusted person. And for us to bring these people to this level of an adjusted person, then we must do one thing. We must first of all adjust ourselves. Although we have said we are wounded healers, before we can heal others, can you also be adjusted? A well-adjusted person is one who makes the same mistake twice without getting nervous. That is, accept your vulnerability, so that when you meet your client, you don't demand perfection. You understand they have issues, not because they are not because they don't have to take care of themselves, just because they are human. So when you accept the client the way they are, they also learn to accept themselves. When you learn to accept yourself as a teacher the way you are, then you learn to accept your learners, your colleagues, and your clients. So the healing starts with ourselves. It starts with us. So we have said there is a connection between the thoughts, the emotions, and our behavior. And this may happen simultaneously, because what we think affects how we feel. And then immediately it will be translated into our behavior. And therefore, the central idea in REB is that the event taking place allowed us, and the actions of the people do not make the person feel good. Sometimes we think our feelings and our behaviors are the result of what happens around us. For example, a person may say, or a person may say that I am very sad because I did not pass the interview. I'm not promoted. And they become very sad. So what comes to your mind? Maybe I'm not good enough. So you remain with sadness. You walk with sadness. That affects your productivity, even in class. Another person will say, I'm not promoted, but maybe there's another chance. And this person goes home happy, is continue being productive as a teacher. And therefore, it has affected how they feel. Yeah, it's okay, there will be another chance. And they continue being productive. So the person who thinks, I'm not okay, that is why I was not promoted, or I'm hated, or someone does not like me, or there was unfairness, there was discrimination, all that. All those are irrationalities. And they are going to affect how you feel, and they affect your productivity. So the same thing, the same event happening to all of us can be interpreted differently and give different feelings and behavior. Meaning, according to rational emotive behavior therapy, we are differently. We look at things differently. So how you look at what happens to you, how you perceive what happens to you, determines your feelings, determines your behavior. Can we, from today, learn how to perceive a positive way of perceiving what is happening to us? What has happened to us? I'm not downplaying what has happened to some of you, or even to me, to myself. But it is for our own good, for our own happiness, for our own satisfaction, for our own health. We give it a positive interpretation, no matter what. So that's what we are calling the connection between the thoughts, the feelings, and the behavior. So we need to be very much aware. We need to guard our thoughts. What are you thinking right now as you are seated there? Are you having positive thoughts or negative thoughts? Remember, that is going to affect your feelings. Your feelings are going to affect your behavior. Maybe you will not be able to take your supper. Maybe you're not able to prepare a class for tomorrow. Maybe you can't even do your assignments. So helping yourself to guard your thoughts, helping your client to guard their thoughts is very important. That is the engine that drives us. And therefore, emotional distress might be caused by dysfunctional thinking patterns. For example, we exaggerate. Maybe somebody said something to you and you really exaggerate it. And you even change the meaning and made a mountain out of a very small thing. Remember, it is going to affect you. Somebody even said sorry for saying something, or just offending in one way or the other. But you not even take a sorry. You are still on the issue. Why are you punishing yourself? You tell a client not to punish themselves, have self-compassion. Then overgeneralization, whereby you think that simply because somebody in a certain family offended you, the whole family is bad. Simply because a fellow teacher said something to you. Maybe you said all women teachers are bad, all men teachers are bad. Overgeneralization. It is dysfunctional thinking. Oversimplification. Maybe something was very important, you prayed it down. Supposed to submit maybe some exam, and you say that it shouldn't bother me. And then later on you realize, oh, I made a mistake. I did not give it the importance that that assignment deserved. Then illogical. Illogical is what we said, negative beliefs. Actions. Absolutist. Think it is done, it will never come back again, and I'll deal with her, I'll never greet her again. I mean, come again. Then invalidated assumptions. Making assumptions that are not worth it, without confirming facts or even jumping into conclusion. That is also irrationality, and many, many others. We can mention many, many things that happen to us every day that are dysfunctional thinking patterns. Therefore, not the things that happen around us that may feel bad. They are these dysfunctionalities. And therefore, these dysfunctionalities contribute to our mental outlook of what is happening around us. You can imagine what you mean now, that it is so easy to be happy. So easy to be happy, just to control the thoughts. As a counselor, therefore, you will come across clients who are anxious or depressed, and they bring various things going on in their lives. Some learners may bring their parents, some teachers may bring their administration, some wives will bring their husbands, husbands will bring their wives. And that causes depression. But it is you as a counselor to help those clients to change the way they think. Because it is not because the husband is bad or the wife is bad or because another teacher told you this and that. It is your interpretation of what is happening. And therefore, what are some of the sources of our irrationality? Why do we become irrational? So the first thing when you meet a client, you want to know why they are irrational. When we say we have a tendency to be irrational, we have it. But what facilitates our irrationality? One is our environment. The environment in which we live in, you meet people who will tell us something, or you experience something which we interpret in a dysfunctional manner. Also, demandingness. There's so much that we are demanded to do. We become inflexible because of this requirement that the others are expecting of us, or even the world around us. And this actually is the root cause of irrationality. Self-demand, you can put a lot of demand on yourself. You want to do so many things at the same time, you have no rest. You don't want to accept you can do some duties, but you are forcing yourself. That will also resort to rationality. Other demands, some people may have demands on you, or you may think they're not treating you fairly. They're not meeting your expectations, and so on. The world is also demanding. Maybe you may think life shows. So we are all moving about every time. Life is not easy. And so the way we interpret what we encounter every day, the way you interpret the current life determines whether we become irrational or rational. So the irrationality simply can also be caused by biological factors. Biological factor, we have said, the tendency in us. And we cannot run away from who we are. Therefore, when you find yourself irrational time, it is okay. Or even social factors, the interactions we have with others. Or even our vulnerability. We are all vulnerable because we are human beings, and so on. So the main types of irrational beliefs that stem from these demands, for example, we have talked about demanding. The world is demanding. And therefore, if you put demands on yourself by talking about a must, then you will become very irrational. But we said we adopt should. Then catastrophizing, believing that an event, a situation, it is so bad than it is supposed to. It is so bad. Maybe somebody has told you something and you catastrophize it. You think it is so bad. It is so offensive. What you tell yourself, it becomes. Then, low frustration tolerance. We do not have the capacity to tolerate frustrations. Sometimes you tell myself, I can't stand it. When things become difficult, you feel it is unbearable. Remember, we have said, we know uncertainties will come our way. Difficult situations will manifest themselves. So we must develop tolerance. Then there is self-downing, concluding that you are worthless or a bad person simply because you have failed, you have made a mistake. But you should see the act itself as separate from your overall worth. If you make a mistake, that does not downsize your worth. You are still a worthy person. The mistake has just happened because of you're a human being. So therefore, let's now look at what are the view of psychological disturbance according to REP. We have already answered this question. We have said that our disturbance will come by because of our irrationality, irrational thinking patterns, or our irrational beliefs. Just that. We become disturbed because of our irrational thinking patterns and irrational beliefs. And we have said this irrationality may also affect our emotions. It affects how we evaluate situations. It affects our interpretation of life situations. And in most cases, it makes us feel like this is so bad, even when it isn't. And even if a situation is so bad, we can interpret it in a way that it lessens the pains that we feel from it. And therefore, what we feel about these situations, it is going to determine our operations, our productivity. And therefore, we are saying every situation must be interpreted in a way that it doesn't create wounds in us, does not create psychological wounds, does not create emotional distress, does not create dysfunctionalities. And then we have talked about this, demanding so much from yourself by using the must. And therefore, any emotional distress and behavioral difficulties are likely to result in unrealistic expectations and approaches in life doing it. For example, if we don't get what we think we must get, we become distressed. So we have a choice. We have a choice to remain healthy or to become disturbed in life, to develop rational patterns of thoughts or irrational pattern of thoughts. We have a choice to feel good about ourselves. We have a choice to be emotionally stable or to be emotionally disoriented. We have a choice to exhibit the right behaviors and otherwise. And that is the message we need to take to our clients. The choice is ours. Remember, in counseling, you're not supposed to advise the client. So you after you have educated them, then they need to be told, it is your choice. What do you want? Can you replace those irrational thoughts and feel good and behave well? The other thing that is very important in REB is ego disturbance. Albert Ellis looked at psychological disturbance in terms of ego disturbance and discomfort disturbances. This is because people make an unrealistic demand on themselves. They also make the same unrealistic demand on other people and the world in general. Because if I'm disturbed, I'm going to affect the people in my life. It is going to affect my relationship. And when these demands are not met the way I wanted them or the way people expected, people put themselves down and they feel bad and unworthy. And this is the opposite of what we said, unconditional self-acceptance, which results in happiness and less emotional distress. Therefore, discomfort disturbance occurs when people make demands on themselves, others, and the world in relation to comfort and life conditions. When these demands are not met again, they ophelize and develop attitude in life. Like I'm today, in the morning, I went to a dentist. And when I came home, I felt I'm so tired lining up and those procedures. So I said, I'm going to sleep for that a minute. Then I resume the preparation for this class. I've run to take a break, not to be too demanding on the self. Before I came to learn about this, how did I overload myself with the task, with the responsibilities? I'm up and down. And by the end of the day, I feel so sad that I'm so tired because I want to satisfy my ego. This is what I want to, I want to be perfect. I want to do it very well. I want to impress. And thereafter, you become sick psychologically. So let's also guard our ego. Remember you did about ego in psychoanalytic approach. We need to guard ourselves. Why are we doing what we are doing? For who and for what reason? Are you doing it for yourself or for others? Are you doing to impress others? And then you are left hurt and so on. Therefore, when we defend our ego, then we are also going to remove, to mitigate the psychological disturbance. Characteristics of this ego disturbance is contingent self-worth. That is, a person's sense of self-worth is based on their performance or the approval of others. Have you tried to do something great to get approval from others, to please others? You meet clients who are just living for others, and they become overwhelmed because they are always striving to please other people. Then using I must, as you have always said. Having a rigid demands that they succeed or be approved of others. There are times you tell yourself it is not a must. I will do it, but it's not a must. Or I'll do it when I have time. The negative self-labeling. We make judgment about ourselves, such as I'm a failure, I'm a bad person. Instead of saying I failed. I'm not a failure, but I failed. Especially when we are dealing with our students. Simply because they never got a certain assignment correct. They become sad. They say, I failed. Simply because they were punished for a certain indiscipline. They hate themselves because they are perfectionists. And even for us teachers, maybe labeling them. Maybe you are stupid. Maybe you look like this. Maybe you the tall one, the short one. You know, those are labels. The dark one, you know, instead of calling them by their names, you are labeling them. And you are hurting their ego for that matter. The ego cage or the ego anxiety is the emotional tension from feeling that oneself or personal worth is threatened. And people tell us maybe something that does not really please us. And maybe they are making a comment that we need to take caution or we need to pick it and make ourselves better. Then we become very emotional. Yeah. So our clients will come to us because of this, the ego disturbances. Know that we need to assist them. We need to educate them as we have just talked about. So the process of change in lab. We have said we are inclined towards irrational thinking. So the process of change here is to be able to change our irrationality and those self-defeatist behavior. Therefore, we need to help our client to abandon these absolutistic demands about life and adopt a more open attitude instead. And the first thing to help them change is accepting that they have a problem. You know, some people will think I'm okay. I don't think that is a problem. I don't think I'm irrational. I don't think I have negative feelings. So let them accept there is a problem. And let them know that the problem has been created by themselves. Yeah, it doesn't matter what is happening in my environment. It doesn't matter what other teachers have done to me. It doesn't matter what the administration has done to me. It is me to interpret it in a way that it doesn't affect me. So owning the problem is the key to REB therapy. We have created our own disturbance. We are responsible for our problems. That's exactly what REB is. And we have said how the client thinks influences their degree of disturbance. I'm saying once again, we are our own enemies through our own thinking, feeling, and behavior. So you don't blame others, we look at ourselves. Therefore, clients are helped to identify that secondary problems that came about as a result of the initial problem. The initial problem was there. The initial problem is there. Maybe somebody has insulted you. Maybe the administration has not appreciated you. Yeah, that is the initial problem. But the secondary problem is our interpretation of what has happened to us. Therefore, whatever has happened initially should not have affected us if we give it the right interpretation. For example, a student may become depressed because of poor performance. That is the initial problem. But the second problem is how does the learner interpret that poor performance? If they tell themselves, I'm not okay, I'm daft, I'm finished, I'm hopeless, not have created a problem. Even for us teachers, the comments we make to our learners, they can trigger this. They can trigger irrationality. They can start hating themselves. So we are saying it could be that the student performed poorly because of factors that are beyond his control. But we blame them for the performance. So the primary problem was an unrealistic blame, or the secondary problem was depression. Both need to be addressed in counseling. So what are the initial problems that we have encountered? What are the initial difficulties that we have encountered? And then what is the secondary problem that we're experiencing because of our interpretation of the initial problem? I'm sure all of us can resonate with this. Each one of us has got something that we are going through. The secondary problem we created by ourselves. We may have nothing to do with the initial problem, but let's avoid the secondary problem. Let's help our client to identify the first problem and the secondary problem, which they have control. We may not have control of the initial problem, but we have control of how it makes us feel and behave. Therefore, clients should identify irrational beliefs and understand why those beliefs are irrational and illogical. Then they should understand why irrational beliefs are preferable, and they should understand why rational beliefs are preferable, and to challenge irrational beliefs and replace them with irrational alternatives. Therefore, the clients are taught by you and me on how their thoughts and beliefs are linked to emotions and behaviors before they are ready to make any change. In the first few sessions, the client learned that feelings are a product of thoughts. Let them know how I'm feeling is as a result of what I think, not events, and that their self-talk influences their feelings. What do I tell myself from the occurrences? This process is known as rational emotive education. That is, you educate the client. And you educate the client to dispute their irrational thoughts and beliefs. When you are disputing thoughts and beliefs, you discuss about what we are calling the ABC model. Therefore, when you talk about the rational emotive education, we are talking about giving our clients psychoeducation. Psychoeducation. Teach the client the relationship between their thoughts, their feelings, and their behavior. Help them to prevent, to be proactive, especially our learners. Instead of treating the problems when it occurs, help them to prevent those negative thoughts. Teach them that they can prevent the negative thoughts. And the negative thoughts, it can also prevent negative emotions and behavior. Therefore, this education, this rational education, they teach us skills, how to control our emotions, emotional literacy, and effective coping strategies. Teach the client about emotional intelligence. Yeah, I can feel bad, but I don't have to act out. I can be angered, but I can manage my anger. That is rational education. Teach them to challenge their irrational beliefs, as you have always said, and then promote key life skills. I'm sure you are still teaching the life skills in schools, like skills of the skill of problem solving, the skill of self-acceptance, taking responsibility, resilience, the skill of critical thinking, the skill of analytical thinking, creative thinking, the skill of having social skills, and so on and so forth. So we have said a counselor is an educator in rational, emotive, behavioral therapy. Therefore, in counseling, the client learn that their beliefs are the primary cause of their emotional disturbance and behavior. And when they come to this realization, they become processors of cognitive thing. They start restructuring their thinking. They become more rational. When we are doing about cognitive therapy, we talked about cognitive restructuring. It is replacing the negative thinking with the positive one. They learn that life does not always work out the way they think, but should life bearable. And I want to repeat that. Life does not always work out the way we think, you and me, and even our clients. But life is still bearable. They loosen the rigid demands they place on themselves, or even on other people, and accept themselves and others unconditionally. See, all this is related. Therefore, the lab focuses on the current present experience, now or here and now experiences, and how we can change and reconstruct our irrationality. And you as the counselor using lab, you do not have to devote a lot of time exploring the client's history or making connections between the past and the present. All what you do is to focus on how are they thinking? How are they feeling? What about their behavior? And with this, you give your client some homework. And you have learned that every client should go home with some homework to be carried outside therapy. And this homework should help them to eliminate faulty thinking patterns and self-defeating attitude and reinforce the changes counseling. Even now, we can also give ourselves homework, all of us. Let's give ourselves homework, all of us. Can we carry out also a homework whereby we can identify our irrationality? Can we identify our faulty thinking patterns? Can we identify our self-defeating attitudes and replace them with more empowering thoughts? I'm sure this will be a good feeling for you, teacher. And once you have consumed this, information and it works for you, that is when we can also be able to help others. So self-help before we can help others. What are the goals of counseling in the lab? We have said, identify irrational beliefs. And I think that one we have talked about it. Challenge irrational beliefs. Challenge them. And when you challenge them, what do? Then you replace them. You replace them with more realistic, healthy, and flexible beliefs and thought patterns. Can we do that unto ourselves? Can we also identify those irrationality we have for ourselves, even other people? We have said you can demand so much from other people, unrealistic expectations. And this can even spoil your relationship with others. When you're expecting so much even from your learners, when you're setting for them very high targets, they can't meet some of them because they have learning disability or other factors. Then what are we saying? That we also affect them. So remember, the irrationality can be upon ourselves or irrationality about other people. And especially for us teachers who are public figures. They improve emotional and behavioral responses. Reduce the frequency and intensity of negative emotions. For example, reduce the frequency of anxiety. Have emotional intelligence. Reduce the intensity of anger, depression. And how do you do this? By changing the underlying beliefs. It is so difficult, it will be difficult for you to change the negative emotions if you don't change the beliefs. It is like dealing with the symptoms. But you want to deal with the real issue. The real issue is our thoughts. Then promote self-acceptance. Teachers, do we have self-acceptance? Do we accept ourselves for who we are? Do we love the job that we are doing? Do we enjoy what we are doing? Or we are still looking for greener pastures and you're always sad, always searching? This kind of thinking will leave you grounded forever. Then equip clients for the future. Once you have taught the client about what is ailing them, then follow them up. Teach them the skills to identify their negative thoughts, to identify their negative emotions and their behavior. Remember, counseling is empowering. You're not counseling a client just for that session. You are empowering the client such that even in the future, they can recall. They can able to reach out that information you are giving them, and they can solve their own problems without coming to you. You don't want this client to come to you every time they have an issue. You want to equip them so that even in the future, they can have what you call self-sustaining information. They can consult themselves for the same. They can heal themselves. Then we have the therapeutic relationship in lab. We have talked about counseling skills. We have talked about how a therapeutic relationship should be established. And in the lab, it is no exception. The first day, you got to have a good rapport with the client. A good rapport with the client, whereby you respect the client for who the client is. You create a very safe counseling environment where the client will feel safe. You promise them confidentiality. You show them that you care by the way you are talking to them, the way you are gesturing, the way you are seated, the tone of voice, and so on and so forth. So good rapport is very important. 2, be actively involved in the process. Remember, you are teaching and you are counseling at the same time. Take a more directive approach because you are teaching. You are teaching. You to take time to teach the client. Some of the clients will come when they are reluctant, as well as who are referred to you. You must be actively involved. It will occur. So this is not the kind of counselor who will listen all the time. You do the reasoning. You do the reasoning and reasoning. But you are also actively involved in teaching. That's the difference between the other approaches and lab. Then be flexible and vary the amount of structure you are giving in counseling. Vary the amount of action and structure you give in counseling. We are not saying you give advice. We are saying directive approach. You are teaching them. Teaching them does not mean you are telling them what to do. No. Then the other therapeutic part is also be patient and approachable. There must be warmth and understanding in the therapeutic process. Okay. So, tendency. Remember, if you don't adopt this directive approach where you teach, the client might develop some dependency. They always want to come to you when they have issues, but want the client to depend on themselves. And then we said, changing somebody's beliefs is not easy. So be very patient. It requires a lot of effort. Let also the client feel they feel free to come to you anytime they need your assistance. So be approachable. As a teacher, as a counselor, be approachable because the client may feel along the way. Because we say we have a tendency to be rational and irrational. When they feel like they are defeated in the journey of becoming rational, let them feel free to come to you because we said it is a journey that requires a lot of effort. So counselors must unconditionally accept the client. We said that. We give our client unconditional positive regard in whichever state they come for counseling. Whatever information they give us, we don't judge them, we don't condemn them. Encourage the client to accept themselves unconditionally, as you have just said. Because some of them, they have self-blame. They have no self-worth. So you can give them the self-worth by accepting them for who they are. Also teach them to accept themselves unconditionally. And teach them to accept others unconditionally. So when they have accepted themselves unconditionally, they will be able to accept others unconditionally. What are the key principles of unconditional self-acceptance? It is accepting your humanity. That is, you are a worth even when you feel like you have made a mistake. You are fallible, you are vulnerable. You are not an angel. You are a human being. And don't rate yourself or your entire life based on specific behavior, but evaluate your actions and traits separately of the self. Then remove conditions. We have said self-acceptance is unconditional. And if you give yourself conditions, then you might also accept others conditionally. We should not condition ourselves in such a way that we value ourselves when we have approval from others, or when you have achieved something. No, you still have your self-worth. Embrace imperfections. We are weak people. Despite being weak, we have the talents, we have gifts, and also we treat the others the same. If you are imperfect, others are also imperfect. Therefore, don't have those parameters of perfection to rate other people. Then promote change. Accepting yourself, you can reduce self-disturbing emotions like shame, like guilt. And this gives you autonomy to focus on and change specific behaviors without being paralyzed by self-rejection. Those are the principles of unconditional self-acceptance, which would build upon ourselves and help our client to build, to inculcate into themselves. Then apart from that, we need to be genuine. Be genuine with yourself and be genuine with your client. If you think you cannot help a client because you cannot comprehend their issues, you don't think you are of any help, then be genuine. Tell them, refer them to another person, refer them to another counselor. Then counselor self-disclosure. We have discussed about the counseling skills of self-disclosure. You can let your client know you are also not perfect. And this self-disclosure should be done carefully, depending on the age of their client, because even depending on the gender of your client, depending on the context of your client. Tell them, I also had an issue and I solved it this way. This will tell the client that even the counselors are not perfect, and therefore they stop blaming themselves. They can relax and discuss with you. And that client can even accept themselves. They can give themselves an unconditional positive regard because they have come to believe that I am not alone. Even the counselor had an issue. Then counselors be empathic. Understand the client's beliefs, understand their feelings, understand their behavior. Show them you understand. Some people, they just need understanding. Some people, they may need listening and understanding. Somebody came to my office for counseling, and She just talked for whole 40 minutes. I was just quiet. And after that, she told me, I think, Daktari, I'm now okay. I just wanted somebody to listen and understand me. I asked her, are you sure you're okay? Yeah, I am okay. I am okay. And I called her after a week. How are you? I am okay. I got healed completely. I just wanted somebody to listen and to understand me. Imagine that's all what some people need on earth. Maybe that's why even our runners need every day somebody to talk to, somebody to understand them, and they get healed. Maybe that is what you need, me and you. Maybe that is what we need, to just be understood, to be listened to. So let's give it freely to those whom we think they need it. So in lab, you can help them to understand themselves, to accept themselves, if we just understand them. Use appropriate humor directed to the current irrational beliefs, especially on self-defeating attitudes and behavior. Humor may not be suitable for clients. Be careful with it. So I am not good in using humor in counseling. Therefore, I rarely use humor because sometimes it can fail. You may make fun. Some people may think you are making fun of their predicament. But there are people who are very good in it. I don't know how it is used because I don't use humor. But if you are the person who is humorous, you can create humor in a counseling environment and make the environment relaxed, make the environment warm, make the environment even more interactive. The therapeutic relationship in lab is one between equals. Remember, when you are starting a relationship with a client, you are equal because both are human. But when the counseling progresses, you become the expert because you have the knowledge, you have authority, you have the skills. So remember, start the counseling session when we are using lab as equals. That's why we sit on the same seat with the client. We don't have tables in the counseling. We don't have wall hangings to tell the client differently from what they see us. We speak the language they understand, so we are equal. But later on, when you start teaching them, then you take your position as an expert. As the client gains more insight and the counselor encourages her to take on more responsibility change, the counselor gradually becomes less directive and the client plays a greater role. As you move on with the lab, as you continue with the sessions, then the client takes the lead. Remember, this is not your session. It is a client session. But to start with, you must start by being a bit more active in the session to encourage the client to also become active. What's the role of the counselor in the lab? We have talked about this. Just to summarize, is to show the client the irrational beliefs, including their should, ought, and must, and how they are contributing to their disturbance. The counselor disputes those irrational beliefs and encourages client to do the same. When somebody comes in saying, I'm hopeless, tell them you are not hopeless. Tell them I'm beaten down. No, you are not yet beaten down. Yeah, help them to dispute their irrationality. Counselors help clients understand how they maintain their emotional problems through irrational thinking and the beliefs, and help the client to modify them. And also the counselors also challenge the client philosophy and help them to develop a rational philosophy of life. And we said a rational philosophy of life is that one of aware, adjusted person, and avoid becoming victim of other irrational beliefs. Then, what is the ABC model of life? A counselor can use ABC model to help the client. This is an important tool for helping the client to identify their irrationality. It helps to conceptualize client psychological disturbance. Where is my disturbance coming from? and work through the irrational thinking and irrational beliefs that is beneath those disturbances. When we talk about A, it means activating events. What has happened to us? What has happened to our nation? It has happened, and you know it has happened. How are we interpreting it? So, B are the beliefs. What beliefs have we developed about what has happened to us? Are we saying we are beaten down? Are we saying it could not have happened that way? Are we saying we'll never be the same again? Are we saying God cannot raise another figure as strong as that one? So those are now irrationality. But if we say God will give us another one, we can move over it. These are life uncertainties. These are difficulties of life. We will rise again. That is positive beliefs. So if you adopt the negative beliefs, then there are consequences. There are consequences. And the consequences are we must start behaving in a way that we are portraying hopelessness. We are portraying helplessness. And that's why we said something happened to all of us. Something has happened in our nation. But the beliefs that we develop out of it will make us different. So the beliefs have consequences. And the consequences are dysfunctionality. You might find some of us, you start maybe some negative coping mechanisms. We become emotional destabilized. We start doing this we could not imagine we would do because we are trying to soothe our ego. And therefore, we are saying that in ABC model is where we help the client to detect, let them detect the irrational beliefs that has occurred because of activating effect, because something has happened. Then let them identify those beliefs. After identify the beliefs, let them dispute those beliefs. You have said A, activating the B and the belief, and you are saying the consequences may be helplessness, maybe then D, help them to dispute. Am I telling myself I'll never be the same again? Let them replace it with positive thinking. I know I can survive this. I know I can surmount it. I know it will be better someday. That is up to D. And so up to that point, we are saying the counselor can ask a client to rate the intensity of their feelings. Maybe between 1 to 10, to know or to get insights into the current disposition. How are you feeling? Are you at 2, 3, or 10? Then the counselor should also identify or help the client to identify unhealthy emotions. Maybe like sadness, depression, regret, guilt, irritation, anger. Then help the client to identify the consequences. And the consequences, we have said, it may be seen in our dysfunctional behavior. Let's be able to identify the secondary emotions. Confront those emotions. Process the emotions. At that point. Then the next step, the counselor can ask the client to identify what are the beliefs. So they can make the connection between the thoughts, beliefs, and the consequences. And finally, we can have this demonstration. We have said something bad has happened to us. That is adversity, activating effect. What beliefs do we have about that adversity? The beliefs are going to lead to emotions. What kind of emotions have we developed? And therefore, at that particular point, we help our client to dispute those beliefs. Challenge those beliefs. Replace those beliefs with the positive ones. And then we have the E, effective new rational beliefs. Help the client to develop, to come up with effective new rational beliefs. And finally, when the client has adopted effective new rational beliefs, there will be what is called new feelings. The client will feel better. And when the client feels better, then we have adjusted individual. So I think that is this is all the explanation of the lab. So then the techniques, what techniques do we have in the lab? One of them is cognitive interventions. And cognitive intervention is what we have just said. Help the client to identify their irrational beliefs, and then help the client to confront them and replace them. First of all, dispute them and replace them with rational beliefs. How do you do this? Deductive disputation. Help the client to identify the difference between rational and irrational beliefs. Use persuasive approach by making the client understand on how rational beliefs are different from irrational ones. Then Socratic questioning, asking client questions that give clients and into irrational and their thinking. That how do you think these beliefs are affecting you? How different could you have thought? Or how different do you think you can think about the same effect? Then functional dispute, questioning the practicality or usefulness of those irrational beliefs. That is, if you continue holding this view of relationship, how do you think it will make your life better? Or how do you think it will make you feel? How is it affecting you? How is it going to affect your relationship? Then empirical dispute, asking CRAN to give evidence that what fact, now that you did not pass the exam, written that you will fail in everything you do in life. Some people will come for counseling because of generalization, simply because my relationship will not work. I will never have a relationship again. That is generalization. It's not empirical. You need to help the current dispute. Simply because you failed in this relationship does not mean that you cannot have another one. Simply because you have failed in this exam does not mean you will fail in any other exam or in life. Then illogical disputes, helping CRAN to see how illogical it is to escalate science and preferences into demands. For example, how logical is it for you to think that just because they have all the qualifications, they must job they apply for? Illogical thoughts, they are what we are calling irrationality. So help them to be logical and dispute illogical thinking. Then philosophical disputes. CRAN often focus on problems in life and lose perspective on other aspects of life. Help them to look at the meaning of life and gain a broad perspective in it. Even though not everything will work the way you wanted or you wanted to go in life, are there other ways you can gain satisfaction in life? That is, why are you seeing life? Why you narrowed life to an event, to just a relationship? Are there other areas that are working in you? Focus on the positive in life. In addition to the method above, you can also ask CRAN to list advantages and disadvantages of changing their irrational beliefs. Each CRAN rational coping statement, like I work very hard, school. Encourage CRAN to replace self-limiting statements such as I can't make it, a positive ones. And then emotive interventions. You can intervene in an emotional way. You have said you can use humor and exaggeration to help the client see the absurdness of some of their beliefs. Rational role-playing can help client express feelings. Believe behind those feelings. You can have a role play with your client, whereby they can even be the counselor themselves, or you can be the client, or role play the role of what is really making them develop the irrational beliefs. And these roles, previously, they can be reversed. The counselor becomes the client, and the client becomes the counselor, and both of you learn how to confront those irrational beliefs. The client identifies the negative beliefs, as you have just said, and you also believe. So the client has got a chance to identify the negative beliefs in the client. And also the counselor will do the same. So this will make them feel they are now in control of themselves. So behavioral interventions. This is going to supplement the cognitive and emotional interventions. For example, you have said you can give them homework to go and try to replace the irrationality with irrationality. You can also have what you call shame attack exercises. You do something they consider shameful, for example, criticizing themselves, you attack it and develop self-compassion. Therefore, LEP counselors seek to help clients stop being too hard on themselves, no matter how badly they behave. The counselors achieve this by encouraging the client to do things they consider to be shameful and embarrassing so that they understand they are not bad. even if they do things foolish. You can also train them, train the client in skills like problem-solving skills, assertiveness skills, social skills, analytical skills, creative skills, and so on and so forth, depending on their needs. And so finally, there are some areas that we can help our clients using REP, of course, all areas, but you can also help them in the clients who are anxious, who have social anxiety, who have depression, anger and aggression, addictive behavior, phobias, procrastination, disordered eating habit, sleep problems, and all other problems. Because you have said this kind of therapy involves the thoughts, emotions, and the behavior. And these are the core areas of counseling. So we have said, we also give ourselves a homework. We go and identify what has made us get stuck in terms of thinking, in terms of emotions, in terms of behavior. Can we also identify some irrationality we have about ourselves, we have about other people that has caused us some even negative emotions, that has also caused us some negative behavior? Can you also identify some negative behaviors that has caused us negative feelings, that has also contributed to our irrationality or unhappiness in life? Thank you so much for listening. I'm also going to do my homework right now. Thank you. Dr. Grace?
Thank you so much, Dr. Margaret. I know my network is very shaky today. Thank you for that wonderful presentation. We're looking forward to learning more from you. We still have another one session to go with you, and then we'll. I think the last one will be with. In fact, we'll be having the last one. Dr. Jogu will be there next week. Then we'll have the last one, and from there we will say what is it that is in the LMS, and how are we able to move with it. And thank you so much. That I already have an idea of what is in it's something I had not even checked in the LMS. That is something that has been repeated, and I know it will be rectified immediately. So, colleagues, thank you so much for being here, for listening, and for also working with what we said, the process. We're just working with the process. And without so much ado, Dr. Margaret Asante, colleagues, tuombeeni. Oh, there could be a question for Dr. Margaret before we release her, please. If there's a question. Irene Musumba, nakuona.
Thank you. Thank you so much for that session, Dr. Mwaura. I would like you please to elaborate on the shame attack. I may be giving an example. I didn't get that part clearly. So kindly, can you elaborate? Thank you.
Okay, thank you. Thank you so much. What we are talking about is confronting, and confrontation or disputation start with what is this that is creating irrationality in you? Is it because you are ashamed of who you are? Sometimes you have even a very negative interpretation of who we are. Maybe because we have not reached a certain level, we are not okay. Or because I don't look the way I would have wanted, or my perception about myself is below my expectations, then I develop irrationality about myself. I'm not okay. Others are okay. What is this that I feel ashamed about? You know, some people will just feel ashamed of themselves, of who they are, especially even the physical self, maybe our whole stature and so on. So we are saying you confront that shame. You confront the shame with some disputation that I am okay. That which sometimes is not about you. Maybe it is somebody who is related to you. You are ashamed of somebody who is related to you, and you can't run away from that person. Maybe I don't even like my profession as a teacher. And that creates shame. I don't want to say I'm a teacher. So that's what you are saying. You confront that shame with rationality. You dispute that irrationality, that I'm not okay, or whatever I'm ashamed of, okay, and you replace that with positive feeling. It could be embarrassment. It could be even something you did and you embarrass yourself. And you feel because of this happening, I am not okay. So the same way, you confront that. And we said, think of yourself as somebody who is vulnerable. You are a human being. You made a mistake, but you learned your lessons. So not keep on learning over what you did. You have to move over it, confront it. Yes, I did it because I'm a human being. And I learned my lessons. And we move on. That's what we mean about confronting our shame, confronting our guilt, confronting our misgiving, confronting, anything that you did that has made you get stuck in life and you have failed to enjoy your life because of it. It need to be confrontation and disputation. Disputation means you are telling yourself, I did it because I'm a human being, and if you're telling yourself I'm okay because of it, tell yourself I am okay and I can move on and I'm human. So
Wow.
that's what I meant.
Oh, thank you so much. Well understood.
Okay.
Yeah, thank you.
Welcome, Irene.
Thank you, Dr. for that elaboration. Any other question or we close? Oh, yeah. There being no other person. Yes, Martin, how are you?
Poa sana, how are you?
Salama sana.
Mimi mniombee tu.
Twakuombea kwa yepi, tueleze.
Sijaelewa vizuri sana ile son.
Oh, hujaielewa.
I've really struggled, eh?
Oh, with the rabbit.
I've really struggled. It looked too complex. I don't know. Is it possible that we can have a repeat session? I don't know. Maybe I'm speaking for men.
It could be true, Martin. Just go through the LMS. You will let me know whether you'd want me to invite Dr. Margaret again. Just go through the LMS and see the notes. Then you let me know whether you'd like me to invite Dr. again.
Akirudia, najua we'll get it all well.
Sawa, Martin.
Because now you realize that counseling is built on all these models.
Yes, all these models is, to see what speaks to you better than all the others. But it's always good to have the knowledge of all of them.
So if you miss out on one or two, I'm sure there'll be a gap somewhere tomorrow.
It is true, Martin. So Martin, go through the LMS and then send me a message. Let me know where we are.
Okay, thank you.
Apio Kelvin.
Yes, Dr. Thank you. Now, I've also been trying to a little bit struggle with the theory, but somehow I also understood some other things along the way. And basically, it's about there is a situation which has happened, and then there's a secondary bit of it, which is about how do we react to the situation, and also how do we interpret the situation. So I just have a simple question, which is also related to what has happened in our country. So it's a family issue, and one of the family members just passed on in my family, and it's like a number of members have moved on, but there's one that is really, really getting affected 1.5 months down the line. So with reference to this theory, how can we assist, or how can I assist this member of the family to move on? So a member of the family has passed on, others we are trying to move on, but this other member is totally affected. So how do we go about it? And I think it will
Dr.
also,
Margaret?
Okay, I'm here, Daktari. So
Okay.
it's what we have said. What we all process grief differently, and it all depends on the interpretation. It also depends on the association or relationship we had with the deceased. And we have said that the way we interpret the death of a loved one affects us differently. There are those maybe they feel because the loved one is no longer there, their life has come to an end. The interpretation they are giving to the loss, it is going to affect them and can affect them longer than anybody else. So as we have just said, it is good to know what are their thoughts about the loss. Their thoughts, what thoughts do they have about the loss? Once you establish what thoughts they have about the loss, what are their beliefs? What are beliefs that have generated from this, from these thoughts? And that is why what you can see now is somebody who is not really adjusted, because it starts with the way they are thinking about it, how they are interpreting it, and now they are the consequences. So how to help the person is after identify the thought, helping the person to dispute those beliefs. For example, they are saying, I am finished. So let them dispute with that. There is life after this. Everybody else is coping. I also want to cope. They dispute it. After they dispute it, we are seeing there will be new feelings.
Okay.
The new feelings, they repress the self-defeating beliefs with the positive beliefs. And once the beliefs have been adjusted, nonetheless, we will be okay with them. But issues of grief can be very complicated. So if you think you cannot take that person along that path, we said it's good to be very genuine. Let this person get a professional help. But it all starts with what they are thinking about it and how they are interpreting it. I hope I'm saying something about that.
Yes, thank you. Yeah, thank you very much.
Okay.
Thank you, Dr. Margaret. It is true, grief can be very complicated and we interpret it differently. Thank you. I think now I'll not give any other person a chance. So I will allow us to close at this level. We will move on again next week. We see where we are. After we finish module 2, we just take another short break as then we come later in with module 3. Tuongozwe kwa maombi kutoka kwa yeyote yule tafadhali, maombi ya kufunga. Any one of us can close for us. Yeyote yule. Before I mention names, I'm good at names.
I can do it.
Pray.
Please, Rosaline, thank you.
Let us believe and pray. Our kind and loving Father, we come before you this evening with hearts full of gratitude. Want to thank you for your love, for your goodness and mercy upon each one of us. Thank you for giving us this opportunity to have this session this evening. We don't take it for granted. And want to thank you for both Dr. Grace and Dr. Margaret for having steered this session this evening. And Lord, we want to pray for interpretation and understanding as we continue. And as we're going to retire this evening, we want to pray for your presence and guidance in all that we do. Give us a good rest, and may we wake up tomorrow to glorify your name. We want to also pray for our families and all the clients that are challenged, Lord. May you give them sanity as they go through these challenges. We ask all this, trusting and believing in Jesus' name. Amen.
Amen.
Amen. Thank you so much, colleagues. Have a good evening.
Amen.
Let us continue. Asante sana.
Amen.